Hello, everyone. You are listening to A Path to a New You, a podcast about mental health and veterans issues. In this week's episode, I want to talk about eating disorders. This week, from February 26th to March 1st, is National Eating Disorder Awareness Week. Hence, that's why I want to talk about eating disorders. I was trying to find a professional, someone who worked in the field, who works with um, clients with eating disorders, but I couldn't find one. So I did some, um, did some work with clients with eating disorders. I have some experience, couple years. While I was working at Rogers Behavioral Health. I was one of those, I guess you say, pool people who worked in the different areas, the different. My mind just went blank. But I did do some therapy with um, those who were having in their eating disorder program. They had groups. It was a partial hospitalization program that I was helping with when their main therapist was on vacation or they needed an extra body in there to help out. So I'm going to use some of the information I know and my experience, and then also I gathered some information from sources, resources, and yeah, so I hope you learned something from it. If not, cool. But I hope you did. Eating disorders are a serious health condition that affect both your physical and mental health. These conditions include problems in how you think about food, eating, weight, and shape, and in your eating behaviors. These symptoms can affect your health, your emotions, and your ability to function in important areas of life. If not treated effectively, eating disorders can become long term problems and, in some cases, can even cause death. The most common eating disorders are anorexia, bulimia, and binge eating disorders. Most eating disorders involve focusing too much on weight, body shape, and food. This can lead to dangerous eating behaviors. These behaviors can seriously affect the ability to get the nutrition your body needs. Eating disorders can harm the heart, digestive system, bones, teeth, and mouth. They can lead to other diseases as well. They're also linked with depression, anxiety, self harm, and suicidal thoughts and behaviors. With proper treatment, you can return to healthier eating habits and learn healthier ways to think about food and your body. You also may be able to reverse or reduce serious problems caused by the eating disorder. So, this, again, the sooner you get help, the sooner you get treatment, the better off you are. That's like any other mental health or serious chronic condition. The sooner you get your treatment, the better off you are, and the better chance you are of getting healthier. Symptoms vary depending on the type of eating disorder. I'm going to talk about a few of them, the most common ones. Anorexia, bulimia, and binge eating disorders are the most common eating disorder. People with eating disorders can have all different body types and sizes. Anorexia, which is also called anorexia nervosa, can be a life threatening eating disorder. It includes an unhealthy low body weight, intense fear of gaining weight, in a view of weight and shape that is not realistic. Anorexia often involves using extreme efforts to control weight and shape, which often seriously interferes with health in your daily life. Anorexia may include severely limited calories or cutting out certain kinds of food or food groups. It may involve other methods to lose weight, such as exercising too much, using laxatives or diet aids, or vomiting after eating. Efforts to reduce weight can cause severe health problems, even for those who are continue eating throughout the day or whose weight isn't extremely low. Bulimia is another common eating disorder. It's also called bulimia nervosa. It is a serious, sometimes life-threatening eating disorder. Bulimia includes episodes of binging, commonly followed by episodes of purging. Purging is throwing up, pretty much putting your fingers down your mouth and making yourself throw up. Sometimes bulimia also includes severely limiting eating for periods of time. This often leads to stronger urges to binge eat and then purge. Some of you may know what binging is, others may not. While binging involves eating food, sometimes an extremely large amount in a short period of time. So you're eating a lot of food in a short period of time. During binging, people feel like they have no control over their eating and that they can't stop. After eating, due to guilt, shame, or an intense period of weight gain, purging is done to get rid of the calories. So as soon as they're done eating, what they do, they go to the bathroom and then they make themselves puke. Purging can include vomiting, exercising too much, not eating for a period of time, or using other methods such as laxatives, taking laxatives. Some people change medicine doses, such as changing insulin amounts, to try to lose weight. Binge eating disorder. Binge eating disorder involves eating food in a short amount of time. When binging, it feels like there's no control over eating. Kind of like bulimia. We just talked about bulimia, where there's eating a large amount of food over a period of time, short period of time. Binge eating is not followed by purging. So the difference is when you have a binge eating disorder, you're eating a large amount of food in a short period of time, but you're not purging afterwards. It means you're not going to the bathroom making yourself puke, you're not over exercising, you're not doing any of that. During a binge, people may eat food faster or eat more food than planned. Even when they're not hungry, eating may continue long past feeling uncomfortably full. Kind of like Thanksgiving dinner where you're eating a lot of food and you feel uncomfortably full. That's happened like once or twice a year. This would happen over a long period of time. It continues over a long period of time. After a binge, people often feel a great deal of guilt, like, oh man, I just ate too much. Disgust or shame. They may fear weight gain. So then they try to severely limit eating for periods of time. This leads to increased urges to binge, setting up an unhealthy cycle. So, for example, they're eating a lot of food, right? And then they feel guilty because they just ate a ton of food. So, what they do is that they severely limit the amount of food they eat for a period of time because they ate too much. And then that makes them even more hungrier. So then they purge again. So it's a cycle. So if they keep doing that, that's extremely healthy and can cause health issues and all that. Another common eating disorder is avoidant restrictive food intake disorder. Avoidant restrictive food intake disorder includes extremely limited eating or not eating certain foods. The pattern of eating often doesn't meet the minimum daily nutrition needs. Like most nutritionists say, you need to eat about 2,000, was it? I'm saying like 2,000 calories a day. You're supposed to eat this kind of food, this many servings of this kind of food. It's like a pyramid. We've been taught that food pyramid we're supposed to follow, kind of, right? So these people often don't. eat the daily minimum nutrition needs, so they don't eat what they're supposed to eat in order to stay healthy, right? So this may lead to problems with growth, development, and functioning in daily life. But people with this disorder don't have fears about gaining weight or body size. Instead, they may not need they may not be interested in eating or may avoid food with a certain color, texture, smell, or taste. Avoidant restrictive food intake disorder can be diagnosed in all ages, but is more common in younger children. The disorder can result in major weight loss or failure to gain weight in childhood. You know, when you're a child, when your child is growing up, they need to eat certain amount of foods. They need to eat more vegetables, grains, all the healthy food. And with this disorder, they don't eat that. So then the they don't get the proper nutrition they need. So their growth is not where they're supposed to be at. If that makes any sense. So technically, when to see a doctor, um, when this eating disorder can be difficult to manage or overcome by yourself. The earlier you get treatment, the more likely you are to make a full recovery, just like any other mental illness or any chronic illness or any chronic pain you have. The sooner you get treatment, the better off you are, the more likely you are to make a full recovery. Sometimes people can have problem eating behaviors that are similar to some symptoms of an eating disorder, but the symptoms don't meet the guidelines for a diagnosis of an eating disorder. I just talked about that here about a minute ago, right? About your Thanksgiving where everybody eats a lot of food, you know, you feel uncomfortably full. That happens maybe once a year, maybe sometimes you do it a couple times a year for maybe Christmas or your birthday or something. But this, in order to meet the guidelines for an eating disorder, there has to be what you're doing has to be continually throughout. It has to be continued throughout, not just a couple times a year, but it's continuing doing this over a few months or so. That's how they diagnose. If you know a loved one who needs or your child needs treatment, just talk to them about it, right? Say, hey, what's going on? If you notice something that's not common, that they're doing something they've never done before, or you see them that their behavior is different, talk to them about it. Say, hey, what's going on? Let them know that you're a friend, and yeah. So just talk to them if you know someone who you see on a regular basis, like a friend or anything like that. Talk to them, see what they need, see if there's if they need help or anything. Here's some of the red flags that suggest an eating disorder. And someone with these red flags could mean they have an like an eating disorder. I'm gonna name a couple of them. Skipping meals or snacks or making excuses for not eating. Having a very limited diet that hasn't been prescribed by a trained medical professional. Too much food, too much focus on food or healthy eating, especially if it means not participating in usual events such as sport banquets, eating birthday cake, or something like that. Making their own meals when rather than eating what their family eats. Withdrawing from usual social activities. Frequent checking in the mirror for what are thought to be flaws. You know, they continuously check themselves in the mirror, continuing over a long period of time. Repeatedly eating large amounts of food. Again, like I mentioned, Thanksgiving, birthday is only a couple times a year. This is when they're continuing doing it like every day, like several days a week over a long period of time. Using dietary supplements, laxatives, or herbal products for weight loss, or they're doing this continuously over a long period of time. Exercising much more than the average person. This includes not taking rest days or days off for injury or illness, or refusing to attend social events and other life events because of wanting to exercise. So again, most people work out 4 or 5 days a week, maybe sometimes six, like myself. However, if I'm sick or I feel like I got pain or like I don't feel good, I'll take the day off from working out, right? I might do a meditation, I might do a yoga, but these people, but those who have a eating disorder, they'll work out, like go full out even when they're sick. Problems with loss of tooth enamel, that may be a sign of repeated vomiting. That's another one. Leaving during meals or right after a meal to use the toilet. So as soon as they're done eating, they go use the bathroom. Talk of depression, disgust, shame, or guilt about eating habits, and also eating in secret. So, what are some of the causes of eating of disorders? They have genetics as a cause, common cause. Some people may have genes that increase their risk of developing eating disorders. I think a lot of the mental health illnesses, a lot of them are genetics. Um, biology factors such as changes in brain chemicals may play a role in eating disorders. Risk factors. Anyone can develop an eating disorder. Eating disorders often start in the teen and young adult years, but they can occur in at any age. Certain factors, again, maybe family history. Eating disorders are more likely to occur in people who have parents or siblings who've had an eating disorder. Other mental health issues, such as trauma, anxiety, depression, obsessive compulsive disorder, and other mental health issues, can increase the likelihood of an eating disorder. Dieting and starvation. Frequent dieting is a risk factor for an eating disorder, especially with weight that is constantly going up and down and getting on and off new diets. A history of weight bullying. People who have been teased or bullied for their weight are more likely to develop problems with eating and eating disorders. This includes people who have been made to feel ashamed of their weight by peers, healthcare professionals, coaches, teachers, and family members. And again, stress is a common factor. Whether it's heading off to college, moving, landing a new job, family or relationship issues, change can bring stress. I know a lot of people eat a lot, eat when they're stressed out. And again, this has happened over a long period of time where you're continually stressed out. Continuing eating over time. Um, so if you're continually stressed out, that's not good for your body for one. And again, you're eating because you're stressed out. It's time for you, if you're stressed out over a long period of time, it's time for you to find some help, reach out for help, talk to somebody. Because eventually that could become an eating disorder because you're eating a lot. Also, I've read out there somewhere where college students can can eventually have an eating disorder because, for example, if they're studying or they're doing homework late at night, they're eating. I know I did when I was going through college. I'm in college. If I'm late at night and I'm trying to stay awake, I'm drinking a hell of a lot of caffeine, a lot of caffeine, and I'm eating snacks too just to keep myself awake. And hence, you do that for a long period of time, eventually that could become an eating disorder. There's all the complications too because of eating disorders. I did talk about this earlier. We're talking about serious health issues, depression, anxiety over a long period of time. Um, having an eating disorder for a long period of time can cause depression, anxiety, suicidal thoughts and behaviors, problems with growth and development, social and relationship problems, substance use disorders, work and school issues, and even death. So, what can you do to prevent this from happening? There's definitely no sure way to prevent eating disorders, but you can take steps to develop healthy eating habits. As an adult, choose a healthy diet. Eat enough grains, whole grains, fruits, and vegetables. Limit your salt, sugar, alcohol, and all that stuff. Avoid extreme dieting. Um, if you need to lose weight, talk to a healthcare provider or a dietitian. Create a plan that meets your needs. Don't use dietary supplements, laxatives, or herbal products for weight loss. Get enough physical exercise. They say you need probably 30 minutes of exercise per day for an adult. Um, Here it says each week get at least 150 minutes of aerobic activity, such as brisk or power walking. Choose activities that you enjoy, so you're more likely to do them. Like me myself, I keep talking about the Peloton. So I work out on my Peloton bike, or I even work out on my tread. So I do that. I enjoy it. I do their strength and all that stuff too through their app. So do something you enjoy. Do activity that you enjoy doing. Seek help for mental health issues if you're depressed, anxious, stressed out, you have anger issues. Reach out to help. Reach out. Find a local provider. You can use Google. I do have some openings available, and I do most of my right now clients I'm seeing right now. I do virtual through Zoom. So, and I'm private pay. I don't take insurance at the moment. If you have children, avoid dieting around your children. Children can pick that up. They see that you're eating the way you're eating, they're going to pick that up too because they see you doing that. They think that's okay. Talk to your child about social media, websites, and stuff because, children and teenagers look at these pictures of these models who are super skinny. These kids, there's teenagers want to look like them, right? And so they'll do anything to make themselves look like that. You want to talk to your teen or child about that and say, hey, that's not a good idea. That's very unhealthy. And continue to talk to them about that. Encourage and reinforce a healthy body image. Tell your child, you know what you look like right now, that's great. Keep it up. You don't want to be too skinny. Talk to them about um, eating and eat what they're eating too. Just continue doing the nutrition and talk about their self image and other stuff too. So just continue talk to them about it. And if need be, talk to your child's healthcare provider. Ask them for help. Ask your healthcare provider for help too. Say, hey, you know what? I think my child's got an issue with something about eating. Something's going on. It's just something's off. Please talk to my child about that. And then your healthcare provider will talk to your child in session, or even your primary care doctor will talk. Say, give them a heads up, and they'll discuss it with your child. Again, reach out for help. There's nothing wrong with reaching out for help. You feel like, you're off, something's going on about yourself, you're depressed. You feel like, you know what, something's off. I need help. Reach out for help. Just go to Google, say, hey, you know what? If I'm stressed out, look for stress management. Google stress management, anger management, something like that. And just reach out for help. Talking about it definitely helps. Just talk about it. Like I mentioned, I have availability. And if I don't feel like going somewhere, just give me a call. We can do I do sessions through Zoom, so you can stay at your house and we talk over over Zoom, and then if I need to send you like information or homework or like educational stuff, I'll send you to your email and we go from there. The next thing I want to talk about are myths and facts. There's a few myths and facts about eating disorders and whatnot. People say, you know what, this is what eating disorders are, blah, blah, blah. I'm going to talk about some facts and some myths and what the truth actually is about that myth. Anyway, 28.8 million Americans will have an eating disorder in their lifetime. Eating disorders have the highest risk of death of any mental illness. Eating disorders, eating disorders affect all genders, all races, and every ethnic group. Genetics, environmental factors, and personality traits all contribute to the risk of developing an eating disorder. So I'm going to talk a little bit about some myths. First myth: my child is only affecting their muscle and body fat by not eating. Truth is, eating disorders lead to severe malnutrition that affects nearly every organ in the body. Malnutrition can cause a dangerously low heart rate or abnormal heart rhythm. Your child may feel dizzy, pass out, or the heart can ultimately stop. Your child may have irritability, mood changes, and difficulty focusing. Their stomach and intestines may work slower, leading to pain, constipation, and or bloating. Myth number two: eating disorders are a choice to not eat enough food. The truth is, eating disorders are complex medical and mental illnesses that patients don't choose. Myth number three: I caused my child's eating disorder. Eating disorder researchers and clinical experts believe that eating disorders are caused by both environmental and genetic factors. People's genes put them at risk to develop an eating disorder, and then different social pressures may cause them to develop the disorder. The last myth I want to talk about is eating disorders only occur in females. The truth is, although eating disorders are more common in females, they can affect anyone, regardless of their gender or sex. I hope you learned something today in this episode about eating disorders. Um, Again, eating National Eating Disorder Awareness Week is started yesterday and goes until March 1st. I do have a Facebook page for my this podcast. It's called The Path to a New You. If you could go there, like it, and follow, I'd appreciate it. I also have a Facebook page for my private practice, New Beginnings Counseling LLC. If you can look it up, like it, and follow it, I'd appreciate that as well. I do post stuff on self care, motivation, and I do post links to my podcast on there. My podcast, A Path to New You, is available in most platforms such as Apple Music, not Apple Music, um, Amazon Music, Audible, Spotify. Uh, available on YouTube now. I just had that last week. So if you don't have any of that, you can go to youtube.com, look up A Path to New You, and it should pop up. I believe I have a total of 20. This is my 26th episode, I believe. Anyway, I hope you learned something. Please follow. Please click on the notification link so then when a new episode comes up, notification will pop up. Say, hey, He's got a new episode up, and I hope you listen. Please rate and review afterwards. I know I have one rating so far on Spotify, so if you do listen, please rate it and please let me know under the review what I can do better. Again, you are listening to A Path to New You. I hope you have a good rest of the day and be well.